Okay, cool.
Hi, everyone. I'm so glad to be able to visit with you a little bit and let you know that I am here with Chelsea from Bighorn Botanicals. And Chelsea and I had heard about Botanicals and Montana U tips some years ago from one of our clients, actually, who knew her dad, Russ. And so I had heard about it, but I actually was at a naturopathic medical conference in Las Vegas and met Chelsea. So I've been wanting her to come on and share with you a little bit about the products that they have and that we have here at Dynamic Health and be able for you to understand a little bit why and when and a little bit of how you might be able to incorporate this into your wellness routine. So, welcome, Chelsea.
Thank you, Carol. I appreciate it. I'm glad to be
No
here.
worries. Yeah, we're glad. I'm so glad to have you. So, would you share a little bit about um, your dad's story and then how you came to be where you are, and then we'll get into all the products.
Okay. Well, I was 5 years old when my dad founded Bighorn Botanicals, and that was in '91.
And you're
He
in
was
Ronan, right? Ronan?
we're in we're in Knoxon.
Oh, Knoxon, Montana.
Yes,
Okay.
yes.
So
So
local.
we are, and it's so funny that you and I met in Las Vegas and not in Montana at the Made in Montana show. How
I know.
silly, huh?
I
But
know.
is what it is. That was a great show. Had a lot of good connections in that one. Anyway, my father founded the company in the early 90s, 91, and he developed the company based on um, the development of Taxol. So my father used to be a outfitter in here locally, and he knew all the mountain trails and the trees in the mountains. Right, he could tell you where to go. He knew every trail by the back of his hand, knows every tree, and was familiar with the Pacific yew tree. And the Pacific yew tree that grows here still, is Taxus brevifolia. And that is your yew tree that is safe to consume as a dietary supplement. And how that got started was my father was under contract with Hauser Chemical Research, and
Hmm.
they were under contract with Bristol Myers Squibb Pharmaceutical Company. So those two companies got together and developed the chemotherapy drug Taxol.
Oh.
So early 90, 91, 92, 93, that project ended in 93. So actually, during those years, my father, they were cutting down the yew trees at that time, and they had harvested over 300,000 pounds of yew bark. Now, at that time, they
So
were,
Ubark's being spelled Y-E-W, just so everybody knows how to
yes,
research that Y-E-W. So U-tip and Ubark, Y-E-U, Y-E-W. Okay.
yes. um, and so during that project, it was actually called the Willis U Project at that time. And so my father made a good chunk of money during those 3 years working for those two major companies.
Hmm.
And he learned in that project that they were killing the yew trees. And my father wasn't really didn't really like that so much. And so he
Yeah.
started researching more about how Native Americans were using the Pacific yew tree. And he came across this particular story where a Native American woman had healed herself from ovarian cancer using limb tips of the Pacific yew, Taxus brevifolia. And she was brewing it into a tea. He had come across that story by some locals that he knew here. And so he started tracking that down. And he had started researching more on ethnobotany research on Taxus brevifolia. And um, he started playing with it himself. So he he went out and cut the limb tips from the tree. Instead of cutting the whole tree down, he said, well, I'm going to try the limb tips. And he brewed it into a tea and he drank it, and it was not poisonous to him. FDA does regulate us, they inspect us.
Mhm.
And the number one question is Pacific U poisonous? And I always tell them no. And I have actually documentation on the safety and toxicity for
Okay,
Pacific U.
good.
And we can email that to anyone who wants that proof. Anyway, my dad had played around making the tea, and it made him feel really strong and endurance. And he was still an outfitter at that time, so it provided him energy. He felt better. And he thought to himself, well, um, I can probably do something with this. Let's develop a company. And he contacted his mother, my grandmother, Inez Waits, and bless her heart, they started the company together. And she moved out here and helped him build it. So uh, she passed away in 2020. It was very sad to see her go, but
Yeah. How old
that's
was
in
she?
87. And she had a
Mm,
stroke, and it went downhill from there.
yeah.
So
Yeah.
I
I'm
ended
so
up,
sorry.
yeah, thank you very much. She was the best grandmother. I learned so much from her. She taught me everything there is to know about running an office, about running a business, about being professional and talking with people. And I remember when she first had me start answering phones, I was so nervous. But I got over that. And she was very, very firm with me, but was always very elegant in the way she taught. So I
Nice.
learned a lot from her. And I learned a lot from my dad. He taught me all about the production, from the making the tea to the tincture and the capsules and the whole production. So I learned from my father and my grandmother how to run this business. And I started in the family business when I was 18. I actually, well,
Nice.
17 when I was 18. And so at that time, I was learning the office route and how to take orders. And I was doing a lot of bookkeeping and learning all that.
Shipping
And
and
shipping, yes, packaging,
mhm.
and customer service. And so through the years, I got better. And now it's just simple and easy to me. So I'm really grateful for both my father and grandmother for this
That's
opportunity.
amazing.
Um,
What
I
a
love
great
what we do.
story.
I mean,
Yeah.
it's amazing because we're helping people. We're helping people and giving them guidance on if they want to choose a natural protocol or a natural supplement to take for an anti-inflammatory issue,
Yeah.
or or stopping cancer cells from replicating the abnormal
Mhm.
cells.
Yeah.
That's where Pacific U comes into play, and it's the natural taxane source. So taxanes is the main component in the Pacific U, Taxus brevifolia, that
Mhm.
promotes healthy cells and inhibits harmful cell replication. And to get a professional background and clinical trials, basically, my
Yeah.
father got in touch with the Biomedical Center in Tijuana, Mexico. And he was referred there by a local cousin. And so he contacted them, and Dr. Mildred Nelson was running the clinic at that time.
Amazing.
And I know. And I got to meet her when I was 7 years old. And I'll never forget it. We were sitting on the porch in front of our lodge. My grandmother had built a bed and breakfast lodge as my dad was outfitting, but also developing Bighorn Botanicals.
Mhm.
So anyway, we had plenty of rooms. So Mildred came to stay because she wanted to see the yew trees. And so Dad said, well, come on to Montana and I'll show you where they're at. And so she came. I was, I think, 7 years old. And we sat out on the porch, and I just remember observing her. And she was an older lady and just very wise and smart. And I felt like there was a connection there. I was meant to meet this lady, you know.
Yeah.
And and she was she was the godsend for my dad to for him to do clinical trials using real patients with
Yeah.
all different types of cancers. Mildred Nelson was the nurse that took that on.
I love
And
it.
she fell in love with the U-tips. And not only the Native American research studies that where the lady was using the limb tips of the tree. Later research came out through the pharmaceutical companies that the constituents are just as good, if not better, in the limb tips. And Mildred
Okay.
Nelson, she knew that instinctively. My father
Yeah.
always told me the story that when he took her up to see the yew trees, she ran her fingers through along the branch and out to the tips, and she said, "I think what I want is in the limb tips." And that's why the Sustainable Harvest Protocol got started.
Oh, brilliant.
Brilliant, yes. And so so during the bark years when they were cutting down the trees, it was a whole salvage operation because they were scheduled to be logged from the logging companies. And so
Mhm.
it kind of worked out, best of both worlds in that situation. But the best thing my father could have ever done is turn this company into a sustainable one,
Yeah.
allowing the tree to grow and put on more foliage. So we rotate these harvest units every 5 years, allowing foliage to grow on the tree. And, it
So you're
keeps our,
basically just pruning.
yeah.
You're pruning
Yep.
them just like you would prune a tree. So yeah. And do
Hmm.
they get taller because you're taking the tips? When you prune from
They
the
get,
side, they always get taller?
yeah, they get bushier. So they
Yeah.
grow more like a huge bush where we live. Instead of a real tall tree, it's more of a large bush.
Okay.
So,
So it puts
and
out
puts off
that's
many
amazing.
branches. Yes. So, and we think that's because of the high elevation here in Montana. The snow impact breaks them down
Yeah. Yeah.
and allows them to grow that way, which actually helps our harvest out because we can harvest one bush and probably get, I want to say, 100 pounds off one bush, depending on the size of the bush. So,
100 pounds
yes,
off one bush.
yes.
That's
So,
pretty awesome.
we usually harvest 9,000 pounds every year, every summer, and we do it in July and August. And the reason why we do that is because the constituents in the tree, such as the taxanes, your
Yeah.
anti-cancer,
Right.
that's when they're most active. They're most prolific in the limb tips in the summertime. And that was also done with the pharmaceutical companies' research. So, yeah, that's how we got started. I mean, that's the background of how Bighorn Botanicals went from the Willis U project to Bighorn Botanicals. So,
That's amazing. So what types of, and now you have more than just the Montana U-tips, but let's go through those products first, and then we'll get into the rose and other things that you guys are doing, because it's not
okay.
just that. So let's tell us about like the tinctures and the capsules and if there's a difference between those and what we use them for, or are they just convenience?
Okay. Um, so we have two different sizes of our U-tip capsules. We have
Okay.
a 200 count bottle or a 400 count bottle.
Ooh,
Now, usually with customers that want to just boost their immune system and reduce inflammation, they'll take 4 to 6 caps a day, sometimes only three. That's based on what they want to do. But we range at 3 to 6 caps a day for reducing inflammation. And usually they'll go for the 200 count bottle. You get more for your buck going with the 400 because it's going to last you longer.
sure.
And with the 400, anyone who's suffering a health ailment such as abnormal cell growth,
Right.
um, They usually choose the 400 count bottle because if they're taking 9 capsules a day, which is recommended for abnormal cell growth,
Mhm.
and that protocol or that suggested use was developed from the professional doctors such as Mildred Nelson at the Biomedical Center. And that is where the taxanes start reducing those cells and
Replication. So that can be like a hyperplasia, just too many cells, like a keratosis. It doesn't always have like when you look at the chemistry behind it, there's a lot of applications, not just this big C word that everybody always dreads, right? So it's like, okay, what can I do to make sure I'm gonna have to play with it on our device and see how it impacts because we have like a mutase isomer enzymes that are cellular enzymes, right? And we're working on that. We work on that every session. We're not,
Mhm.
I'm not treating anything. I'm just boosting your body's ability to replicate correctly. And does that make sense with the U-tip as well?
Yes, it
Right.
does.
So there's
Yes.
all kinds of different applications. It doesn't have to be something uncomfortable, or you don't have to wait until there's a big stamp in your chart at your doctor's office. You can be proactive because we all produce these unhealthy cells every day, right?
Yes.
Yeah.
Yes. Yes. And so the general health maintenance, people, a lot of customers take, 4 a day is usually, I hear more from customers.
Mhm.
They take 4 a day on average for just the general health maintenance. And that it boosts your energy. It makes you feel better. You breathe better. We have so many customers with lung problems and lung
Mm.
issues where this will help open up your lungs and it just provides that. I'm not exactly sure how the mechanism of action works in the lungs with the U, but I know there's other constituents in there as well besides just the taxanes.
Sure.
There's vitamin B12 in there. We tested that in 2018 and found that there's naturally occurring vitamin B12 in the Montana U-tips. And that's a phenomenal thing. So it
Yeah.
usually just comes from meat.
Yeah, because it's
So
like methylcobalamin, right? So it's methylated when it comes from a natural source like that, as opposed to a synthetic version,
yes,
right?
yes.
The
And then we
cyanide
have
version.
tincture too. Oh, okay. So the constituents, I'm not going to get off course here. So also there's quercetin, which is also an promotes abnormal cell.
Anti-inflammatory. Yeah, there's lots of different
Right.
components of quercetin. Yeah.
Yes, and so the flavonoids, you got your antioxidants, your phytosterols, beta cytosterol. Now that's really good for prostate health, which we have a lot of customers using the U-tips, nine or more capsules a day if they have really high PSA levels
Hmm.
and they are getting into the prostate C word situation.
Yeah.
And
Yeah.
so
Well, yeah, if you're going to start doing invasive procedures, right, where they're looking at, okay, this is something you're going to want to deal with.
right. We have a lot of gentlemen call, okay, my doctor, I was referred to you by a friend, and my doctor says I have a PSA of 25 or 30. And we're like, oh dear, that's really high. Well, we recommend 9 a day because of the doctor's suggested use on the 9 being more proactive faster.
Mhm.
And or they can take the tincture. So they have those options, which you held that up. So the
Yeah.
tincture is an alcohol extraction of the U-tips, which I feel is more, just a tad bit more potent than the capsules because it pulls all those constituents and keeps it concentrated. And a lot of men, I mean, it's on your preference. If you want to take capsules, that's easy if you're used to taking a bunch, right?
Well, they travel easier, right? I mean, they're not going to
They
get
do.
harmed when you go through,
Mhm.
go on through the airport. And so if you're going to be traveling, I personally prefer, even if it doesn't taste fantastic, can you mix this tincture with like another like a cup of tea or with something else, you can mix it, right? So you could stick it in your apple juice in the morning or something like that if it bothers you. But I prefer liquids because our limbic system is engaged and your body knows what's coming and it learns how to absorb it, right? And I
Yes.
I have just become a huge fan of homeopathy with liquids and tinctures, but I also grew up on tinctures that were really strong. So this
Me
this
too.
is yeah. Yeah, I bet you did.
I'm actually drinking rose tea right now with rose tincture in it.
Oh,
And with your products, I always recommend add the tincture to your tea. It gives it a stronger boost, much more effective, and hits the digestive and bloodstream quicker. So,
yes, yeah, much more bioavailable than having to break down something dry, right? And yeah, I love the tinctures myself. Those are much more suited. All right,
yes.
tell me about the salve.
So the salve was developed because Mildred Nelson requested that my father create a product that could be topical on abnormal cell
Topical.
formation,
Yeah.
topical, yes, conditions.
Hmm.
So she
Hmm.
needed a cream that was going to help prevent scarring and rejuvenate cells, the skin cells. So healing faster, of course. She used black salve, I know that, to pull cancers out, and after that she would use our salve for the healing process
Hmm.
and prevention of it coming reoccurring. So
Excellent.
that's why Dad created the Montana U-tip oil, which is our main ingredient in the U-tip
Hmm.
salve, and beeswax is the stabilizer.
Stabilizer base. It is
Yeah.
lovely. And I have used this on many different, on different spots and different things. I had a a bug bite and it just wasn't healing. Like it was just sticking around. And I'm like, No." So I just put the Montana U-tip on it and I just use a Q-tip so I don't ever put my hand inside of it. Beeswax
Mm-hmm.
is naturally non and you're not going to grow infection very well in that anyway, but I just
Right.
put that on that wound that was just a bug, but some of that
Mm-hmm.
toxicity, right? Their venom was sticking behind the mosquito venom and it was just being ornery and it
Yeah.
was not going away. And then I had another spot on my back and it was just a rough spot of skin and it just was kind of sticking around, wasn't discolored. It doesn't scare me, nothing like that. But I was like, that's not like the rest of my skin. So one of these is not like the other. And then I just thought, I'm just going to put it on there. It's great.
Yeah.
So
Yeah.
very soothing. It
I
doesn't smell. It's really nice.
Yes. Well, it has antibacterial and antifungal and antiviral properties. And so that's your carotenoids and lignans properties,
Mhm.
constituents, excuse me.
Yeah.
And so it plays many roles in rejuvenating cells inside and outside your body.
Hmm.
And with any health ailment, of course, I've always recommended to the customer treat it from the inside out, even if it's
Hmm.
only topical, but it
That's just a
is,
symptom, right?
yes. So, and usually they listen.
Okay.
And then they
So
feel better.
yeah. And I didn't have this salve. I used black salve myself once um with a it's another whole story and a whole situation and but it was my grandmother's recipe of black salve. So I grew up with
Mm.
this background of people who are, just harvesting and growing around them and knowing how to use nature. And so
Mhm.
I didn't have the U-tips, but I can see that it would have been really great. I had a yellow Pulling salve, and I know people that have used like a bag balm type of thing, but this would be so much better, so much better.
Mhm. Mhm.
Okay, so I had a new thing show up on myself on our last order, and that's the the soap.
Soap. Yes, the soap. We make that
I
that
haven't tried it
takes
yet.
all day to make. It's quite the process. It's a cold process soap. So we're using the lye, sodium hydroxide, and our Montana U-tip oil and pomace oil. And when those go through the saponification stage, the lye is no longer active and your oils are active. And so we it'll settle up. We pour it in a big pan, big old soap pan, and then it sets up for like 4 to 5 days actually until the lye all surfaces to the top. And then we just shave that right off, and it's a beautiful green bar soap. And that green is natural from our U-tip oil.
That's great.
And so that helps a lot of our customers that suffer from psoriasis and eczema and dry skin problems. It's a good moisturizing soap, and it's good also on sensitive skin. So if
Excellent.
someone, it's unscented, so there's no fragrance in there. And one day I'm gonna come out with a fragrance. I have a lot of customers that always ask me if I'm gonna do that. Yes, one day.
Well, but then when you add that for one, you're going to take away from another. I personally love unscented, and if they want to mix their own essential oils from their favorite company,
Hmm.
you might, I don't know, you might be dodging a bullet by not.
True.
I mean, you could, it'd be kind of cool to put like a Bach flower maybe in
Oh
there with it. Instead of
yeah.
doing an actual essential oil
Scent.
that is super concentrated and has the potential to have a lot of sensitivities and things, you might be able to get away with a Bach flower or something like that.
It's a good idea. Yeah.
Yeah, who knows? Fun. Okay, so what else do you have back there?
Okay, so we have also the lotion. Lotion is very moisturizing. People love it. And the Montana U-tip oil, of course, is the main ingredient. The other ingredients are AC or vitamins A, C, and E. There's safflower oil, calendula, cucumber extract, aloe
Nice.
vera. There's all kinds of good stuff in there, and it's pretty popular. We used to have a scented lotion, but my scent discontinued. The company discontinued it. It was so sad. So I actually had a product that was discontinued, and that was our Econocuke lotion, which I'm bummed about that. But a lot of our customers are more for unscent anyway. So I sent this email blast announcing that change, and you know what? No one really cared. So that's
Yeah,
okay.
active
Natural good.
ingredient, it's okay.
Yeah. Let me talk about the powder a little bit. The powder is um, exactly what's in our capsules. So our capsules is just the U-tip powder, and there's no fillers in those. And so these bags, it comes in a 1 pound or a 2 ounce. And obviously 2 ounces basically a sample pack. They can try
Yeah.
it, and they can include this in smoothies or already cooked food.
Oh,
Don't
nice.
heat it up. Or if they make their own capsules at home and they want to include turmeric with it or spirulina, they can do
Yeah,
that. It works
that makes
synergistically
sense.
with it. Yes.
That makes a lot of
And
sense, actually.
yeah, let's see. We talked about the tincture and the caps and the tea. The tea, not so much,
The tea, not
but
yet, not too much yet, a little bit. What other,
oh,
so you have that tea.
so we have the 1 pound UT
Yep.
and 2 ounce UT. Of course, we like to offer that small size to give people a try.
Yeah.
This is um, it's I like to call it an earthy native bitter taste. People don't like the word bitter so much, so I like to say earthy.
Bitters help you lose weight. Bitters bitters help you lose.
Well,
Bitters are good. Just have to
yes.
embrace the bite.
Yes. So Mildred Nelson created a protocol way back then, 94, 4 to 6 cups of UT a day
Okay.
for a serious health ailment. Now, I'm not sure why it was only that. She obviously saw great results with that protocol.
Mm-hmm.
I feel like 6 cups would do more, and the reason why I say that, the more you take of a natural product, the faster it's gonna work.
Right.
So,
And so do people need to kind of start out gradual and build their way up, or is it better to do like what they would call a loading dose? So I know that like with niacin, right? That niacin flush, a lot of people, I can't tolerate it myself. My blood pressure bottoms out, but but a lot of people they're like, well, if you're going to do niacin, you need to start with a loading dose versus the Montana versus other things where they start out really gradual, kind of get your body used to this idea and kind of build your way up to like with vitamin C, sometimes they use it as shock, but more often than not, if you're wanting to build up those antioxidants in your system, you can't just take 50,000 units of vitamin C in a day. You're just going to
right,
be in the bathroom the whole day. So
right.
you have to go with based on your tolerance, right?
Mhm.
So
Yeah.
is there one or the other?
Well, I mean, it's based on each individual, right? So if I'm
Right.
talking to somebody on the phone and that's their question, I will definitely recommend you start at a low dose and you work your way up every week.
Mm-hmm.
And like that low dose you could start at 2 capsules. Let's just
Mm-hmm.
use capsules for
Yeah.
instance. Uh, 2 capsules a day. Do that for a whole week, and then the
Mm-hmm.
next week move up to 3 a day. Yeah, you got to kind of train your body to get used to it and
Right.
process it right.
Mm-hmm. Mm-hmm. Build up the enzymes and those kind of things. So I think
Mhm.
sometimes we're very brutal on our system and we think because it's natural, we don't it's okay, it can't hurt us. And this isn't just because it's not toxic, doesn't mean your body knows what's coming. So if you've
Mhm.
never had dates before, right, and you ate 9 in one day,
Your
that
body's just going to reject it and flush it
right,
out. It's not even
right,
going to utilize it the correctly. It's not going to absorb it. So your
right.
body is going
So
to be like if I told someone take 9 capsules and start today, which that happens a lot if that is what they want to do. And if
right.
they're comfortable with that, go for it. But
And
I
some
always
people are
recommend,
like, you know what, I don't care. I don't mind being uncomfortable. I'll just hit it with all I can and I'm just gonna hammer it as best I can. And they just get really, really aggressive. And it's like, just a few days. Even if you just increased by one a day, it would be
mhm.
a little more
Yeah,
kind.
so, like there a few ladies throughout the years. We've never had an adverse event reported with our products ever. On
Excellent.
occasion, I'll get a call and they'll say, I think I'm having some diarrhea, and I don't know if it's your product, but what would you recommend? And I always tell them, okay, stop taking it for a few days and then ease back into it and take 1 capsule for
Mm-hmm.
this many days. Usually I do the week thing, week
Yeah.
by week,
Yeah.
because that's given your body enough time to get used to it and recognize what's being put in it.
Yeah.
um, Another thing is like if you overload it, like I said, your body's just going to excrete it. It's not going to absorb.
Yeah.
And that's why you're suffering from diarrhea.
Mm-hmm.
So that's
Right.
why we always
Build
recommend
bowel
just
tolerance.
yes.
Yeah, if you get to a point of bowel intolerance, then you need to back up. There's also, when you're looking all the quercetin, the bioflavonoids, the phytosterols, all of these things that are supporting your system, it's like I equate it to cleaning out the, hall closet. The so when you
Mhm.
start cleaning, it's messy, right?
Yeah.
And if you did one
Yeah.
shelf at a time, it's going to be less messy than if you know, took a water gun and just blew the whole thing apart, and you're going to make a really big mess. So it's okay
Mhm.
to do a little bit at a time and work up to what you can tolerate, what feels good to you, what your size is, like a 400-pound person. is maybe different than, I had a client last week who's early 30s and she's just having inflammation, joint pain, that kind of thing. Well, she weighs maybe 110 pounds. Well,
Oh,
yeah, so she might work up to three and just stay there.
mm-hmm.
She might do one for a week and two for a week and then three for a week and watch and
Yep.
see how she feels. If she feels amazing at three, then you don't have to go to six. Is that correct?
Right. No, if it's working for you at that lower dosage, there's no need to take more. Like I said,
Hmm.
your body is going to expel it.
Right. And you're
And it's
stimulating your body to
what it
expel a
needs.
lot too. Yeah.
Yeah.
Yeah. Well, and how great to have the B12 component because they don't detox very well if they're like MTHFR positive. They don't process that very well. And so I would think that the liquid would be much more absorbable and then they'd be able to manage that inflammatory process that so many of those people are struggling with. So anything on the natural side that we can do to give them that extra peace of
Yeah.
mind, right? Anything.
Yes. Yes.
All right. So is there anything else that I missed? Tell me about your rose tea.
Yes. So the
I saw a
rose.
picture on my email, and we'll talk about the newsletter in a second. So I got
Yes.
the newsletter. It's this beautiful picture of these roses, which is my favorite old-fashioned Montana rose, right? Old-fashioned rose is my favorite flower. So I'm really excited to hear about this because I haven't tried it
Oh,
yet.
oh, it's so yummy. It's so pleasant. It's elegant, it's pleasant, it's really easy on your guts. And it does help with the digestion. And I notice it also adds like a calmness feeling for you.
Mm.
Just
Like
makes
a
you feel,
lavender, but not
yeah,
so smelly.
yes, yes, exactly. It does work in that way. I've had a few naturopaths report that back to us as well. They use it for some of their clients that just need to chill out.
Yeah.
But
Yeah, the roses, with Bach flowers and there's a lot of everything in nature. We talk about like in homeopathy, there's singulars, right? But and they're like, you can't do combination homeopathy. And I'm like, a singular is not it's a combination all by itself, right? Look at all the
yeah.
different components that naturally occur with Montana U-tip or with a rose, right? Or belladonna or arnica. There's a lot of different applications and there's a lot of different components in nature. Anything that occurs in nature has a lot of different active ingredients and it has a lot of different uses. So,
Yes, and the reason why we brought it in to the product line, my father, he loves to have a research backup study to the herbs that we bring into the business. So the Rosa nutcana was the wild rose that was used in a study through University of British Columbia. A professor went out and got several different herbs, including Rosa nutcana, to test it in a petri dish against coronavirus back in the 80s, early 80s,
yeah, yeah.
and found it was active against it. And
So that's like a culture insensitivity. When they're looking for a bacteria, they'll put it in a
mhm,
petri dish. They take your blood, they take sputum, a body fluid, whatever, put it in a petri dish and culture it, right? Allow it to grow. And then they check the sensitivity, which antibiotics are going to work on that particular bacteria. So that's a similar thing that they did with the virus, right?
yes. And so we brought this in 2020. And because of the COVID boom, my dad was like, what could we, because we needed a new product. And my grandmother had just passed away, and my dad was just, he's going through some things, but he wanted to bring a new product in, and he was thinking about it for months, and he and he remembered this Rosa Nut Canna because long time ago, I think it was back in 2010 and 11, when he did have 13 other different products, and it
Mm,
was. like St. John's wort, echinacea, nettle leaf, rose,
Right.
huckleberry, serviceberry. I mean, he had a bunch of different tinctures. And then when he had an FDA inspection, they wanted him to lab test all the ingredients for all these different type of things. And us being a small company, we just simply couldn't afford it.
Yeah,
So that's when,
it's wildly expensive.
yes. Yeah, so that's
Yeah.
when he dropped all the other products and we just our main niche was the U-tips.
Yeah.
So we kept that product. So in 2020 was our second product that we brought in and as a single ingredient. Single ingredient is easier and more affordable to test than a multivitamin or a
Yeah.
multi-ingredient tea or tincture or caps. So it's all based on, your budget as well.
Oh,
So,
absolutely. Absolutely. I know I've seen even a change of use authorization where there's something that's already out there and you just want to use it as a salve instead of as a capsule or something like that is like $3 million just to,
mhm.
and it's already there and it's already researched and it's, so
Yeah.
it's huge expense on a business, especially a small natural business. So kudos to you for going through the process that you've gone through and to your dad for being wise enough to keep um the thing that was your thing, right?
Yeah. Yeah, I had an inspection last June. It was the first time I went through an FDA inspection without my dad, and she was here for two days. She
Hmm.
was my age, this inspector, and she had already worked in the dietary supplement industry before she became an FDA inspector investigator. And I actually got along with her. And I tell you what, if you're going to go through an FDA inspection, you be polite, you answer every question, you have all
Hmm.
your documentation ready to give to them only if they ask for it. You never offer information, you only
Right.
answer questions, and you be very nice. And the inspection will go smoothly. So, and the fact I had all the supporting documents she asked for, and if I didn't have something and I corrected it in front of her, that was kudos. She didn't write me up.
Yeah.
So there was four discussions. She called them discussions that she left me
Hmm.
on a post note, but I still had 10
On a
days to
sticky.
respond on a sticky note. Yes. And she didn't issue me a 483, which this is the first time our company had not gotten a 483. A 483 is not good in dietary
Right.
supplement world. It's like an F on your test.
Right.
So I was very excited and happy because she could see that I was really trying to comply with everything she asked me for.
Authentic.
And
Yeah.
yes, and she just saw, we're doing a good job trying to keep CGMP compliance, your good manufacturing practices.
Right.
So I think she gave me a little bit of a high five inside because I did have everything she asked for, and if I didn't, I corrected it in front of her. So
Awesome.
that
Yeah,
was
I know
cool.
that our biofeedback manufacturer here in the US now has gone through the FDA inspection and it was similar. It was somebody in their 30s and it or maybe early 40s, but fairly young, came in, asked the questions, went through the process and no dings and really nice. So they were
Yeah.
just like, well, we're just going to walk through this process and see
Mhm.
how, see what they need. And they had
So
all
it
the
was funny.
documentation, everything there.
My dad never really trained me on the equipment, so I kind of had to teach myself all that. And she gave me a lesson because she looked thoroughly in my equipment. And if that looked a little too powdery, I had, someone clean it right in front of her, like, my production workers, so they could learn you got to do this way,
Yeah.
you know. right there, then and there, and she appreciated that. And I had a part that had a couple dings in it. She said, "Oh, you need a new part, and I will write you up if you don't get one." So I was so thankful. Capsule Gel was so fast with me, and I got the part before she left. In 2 days, I got proof of the order, and it was here by that next day. She had gone, but anyway, it just
Taking care
happened.
of.
So, so yeah, I thanked her also for, pointing out things that I should have been looking at more thoroughly.
Yeah.
And she appreciated that, of course, because I praised her on good job. You're helping me do a better job. So,
Right. And good that they're paying attention to quality and good manufacturing and clean manufacturing for the nutraceutical, right? For nutritional supplement world. And it's something I wish the natural supplement world kind of monitor themselves a little bit, kind of like the movie industry did. The government came and said, you can't just throw anything in there on that screen. People need to know you need a rating system so they know if
mhm,
they can bring a 4-year-old with them to the movie or not, right?
mhm,
And so they were like, we're going to start rating all of your movies. And they said, we understand, we agree, we will take care of it. So when you find a movie that's not rated, it means it didn't go through that process, but they organized it themselves and
mhm,
said, we will set a standard, and then they approved it. And so the government didn't get involved with that. But I kind of wish the natural world would make their own stamp of approval that it's a good manufacturing practice, and that the ingredients that are included are exactly what it says are included, because everybody's not on the same page as you.
right. And then they give us all a bad name that are trying to do a good job.
Right, right.
So,
Yeah,
um,
so I appreciate that. Well, with that, I think we'll call it a wrap up. Do you have any questions or anything else you want to add?
yeah, I forgot to mention recently I had our laboratory test if there was any vitamin C in our rose tea, and there is, and
How much?
not very much, but it's 210 milligrams in the whole four
In
ounce
the
pack
bag?
of tea. Yes. So we know it's there, it's active, and I'm having her determine how much is in 1 teaspoon, which 210 milligrams in the whole 4 ounce. I know there's not going to be that much. And I know
Mhm.
people need a certain amount of vitamin C daily, right?
But if
But
it's
that's a
more
good.
bioavailable, that's different. So most people are taking vitamin C and it's ascorbic acid, which
Hmm.
is from corn, right? It is
Yeah.
this is right. So it's not going to be as bioavailable as that is. Same with like calcium from milk versus calcium from broccoli, right? So you can have
Mhm.
100 milligrams of calcium in a glass of milk, and you can have 100 milligrams of calcium from broccoli, but you're going to absorb 90 milligrams from the broccoli, and 10 milligrams is what you're going to absorb out of the milk. So I look
Right.
at a product like that and go, okay, 200 milligrams out of that in terms of vitamin C, you're going to absorb all 200 milligrams, and it didn't
Yes.
come from corn.
Right.
Right.
Um, so with the vitamin B12, with the capsules, we do know that there is 5 mcgs per cap. And
Okay.
I think daily FDA daily intake, I think, is 6 mcgs.
Micrograms, right?
Yeah. So that's pretty phenomenal
That
for a
is.
plant. That.
Yeah. Yeah, it is. That's amazing. I love that. That's
Yeah.
fantastic. Well, I learned new things. That was
Mhm.
cool. And I'm gonna add rose to my next order. So you have the rose tincture and the tea, right?
Yes. Yes.
Okay.
So here's our tincture. There.
Mm.
And I'm actually getting new labels done pretty soon. We have them all redesigned to where you can read those letters better. I'm having them, they're going to be changed to bold blue color so you can actually
Well,
read
a
it.
picture's worth 1,000 words. You can see the roads in there.
So we did do that with the Lomatium. Lomatium we hadn't talked about yet, but this
Oh,
is a
yeah.
wonderful herb. And it's an alcohol extraction, a tincture. This herb goes where the infection is in your body. It goes straight to that infection. So
So
that's how
what
that
is
works.
that the plant? Lomation is the
Lome,
name of the plant?
it's a root,
Never
Lomatium
heard of
root.
it before.
Okay, well, I'll send you some more information about that.
Okay, I'll
And
add
it's
it
also a
to.
strong antibacterial and anti-inflammatory as well. But a lot of our customers like to combine this in the rose tea or just drink this if they have a serious lung condition. My
Yeah.
dad actually used this. He had pneumonia like 3 times, and this is what helped him get through
Mm-hmm.
it. Something
Yeah.
like this. And you only use this when you need it. This is a very strong herb. So
Okay.
you
So
use
kind of
when you
like an echinacea. You don't take it all the time. You don't, yeah,
right.
you give it a little break.
Yep. It's very.
Interesting.
And then our newest product, Devil's Club, the Montana Devil's Club tincture. This is an adaptogen tincture.
Okay.
And so, let's see, we brought this out, it was last October or last November. Yeah, something
It
like
was
that. Well,
after
that's,
the naturopathic medical, but you had said that you were bringing that out, so I just haven't
yeah, we
played
had
with it
harvested
yet.
it then, and I think I waited actually till January, the beginning of the year as a new product is when we brought that out. That's right.
So
And
tell us more about what you use that for.
a lot of people, honestly, just the lung issue. It's a lot similar to the lomatium, but
Okay.
you could use this more as a preventative for respiratory problems like the
Okay.
rose.
Okay.
And I will go ahead and email more information about that that you can share.
Okay. Cool. I get to expand. Well,
Yeah.
I love that you're local. I love that you're here in Montana and harvesting so many of your products right here local. You did some of the rows in Idaho,
Mhm.
but really being truly native, right? And I love what you've done and what you're doing and that
Thank
you're keeping your dad's hopes and dreams, giving it that foundation is so much work. It's like once
you.
something's in motion, it's easier to keep it in motion but to get it started and when you start something from scratch, it just takes so much effort and so many years and so much time and thought and
Mhm.
sweat and tears and blah blah blah, right? And you
Yeah.
have this push, and it's so great that you're utilizing that and honoring that energy that come from Mildred and from your dad and keeping
Oh,
it
yeah.
going and from your grandmother, right?
Yes. I
I have
mean,
a similar
I was
grandmother.
born to do this. So this is what I was born to do. And I love what we're doing. I love what my father created, my grandmother and Mildred and everyone we work with at the biomedical center. Everyone's so awesome and cares about people and cares about helping people find hope in natural therapy and
Yeah,
success. So
I love that. Good
that's what we're
job.
here for.
Cool.
Thanks.
Well, Chelsea, thank you for spending time with me today and explaining this.
Mhm.
And I'll send you a copy of our recording, and I'm so grateful for everything that you're doing, and happy to have this product line here with us, and look forward to expanding more. And it's going to be fun. So
Thank
thank you
you.
for doing that.
You're welcome. I'm
You
here
bet.
for to answer any more questions. So
Perfect. Right. Thanks, everybody, and hope you have a wonderful, wonderful day and stop by. If we don't have it, we will order it for you. So if there's a product that you have in mind, give us a call, or if this goes out to somebody else and it's through the grapevine, however it always seems to reach the people that need it, right? Who are ready and who need it. So we're just going to leave that up to the universe to find them. I love that. All right,
Yes.
thanks so much. And I'm gonna just say goodbye to our email group and thanks you guys for all your love and support. Have a great day.
Thanks, Carol.